Welcome everyone to another wonderful episode here, Doctors of Podiatry. Very interesting case. Very young patient who has presented to our office with the chief complaint of bilateral great toe pain. Extensive history in respect to possible fungus to both great toenail plates, 1 and 2. A very long time ago, the patient had some procedures for the ingrown toenails. Cliff note version, long story short, local dermatologist, they treated her with some oral terbinafine Lamisil for possible fungus. Let's start off with the right foot, which is the one that's really a little bit more affected. As everyone may or may not see, the issue here is the patient has suffered tremendously throughout the last, we'll say, but this is a chronic condition, many years. And because of a lot of variables, including the patient's occupation, the patient has developed a bulbous, right, tip of the toe. The nail is extremely small, extremely small. I want to give you guys the side view, and you guys can see we've spoken about this before, about the ramp, right? You see how this is sort of going up like a ramp. So when we put the toe, I'm just going to bring the toe down a little bit here, you can really appreciate the quote-unquote ramp. And what I want everyone to see is look at the nail. It's basically pointing upwards. So the nail grows out, it hits the tip here, and of course the nail cannot clear this. That's when we've done the toe tuck in the past, where we've done these distal tip reconstructions in order for the nail to grow out smoothly. We went ahead and took x-rays of both the left and the right great toes. Let's take a look at this one before I continue to talk. Again, as everyone can see, the nail's a little bit more, it's bigger in size. Yes, it is incurvated on both sides. Again, the patient has been battling ingrown toenails for quite some time, but nonetheless, that's not these are the symptoms of the problem, right? The underlying problem. I'm just going to go ahead and do this again as well, so we get it from this side a little bit better. So again, kind of like the same issue, right? But to a lesser extent. The nail's not pointing upwards. So basically, let's look at the whitey board here. So side of the toe, first metatarsal, proximal phalanx, distal phalanx. This is the bulbous tissue, right? And then right here is the nail plate, which is basically ramping up that tip of the tip of the toe. The problem is we took an x-ray. The patient has a bone spur sitting underneath that nail plate, and there's a very high likelihood that part of the problem, right, this is the contributory factor. So what we basically do is a minimally invasive procedure. We've spoken about it in the past. It's an excision of a subungual, sub means underneath, subungual exostosis. Make a tiny little incision right here, 1 stitch. We come in and we basically erase this, okay? Once we erase the problem, right, we'll also go ahead and remove both toenails. We've done that before. And then we pulse dose oral terbinafine. I have been very clear with the patient that this is a combination of fibrous scar tissue, like rubbery tissue. This is not going anywhere. If we can, and the patient was very clear with me and basically said, listen, Dr. Wagner, my problem is that I have a lot of pain. anything that presses down on the nail causes a significant amount of pain. So imagine we have that spur here, so you're pushing the nail against the spur, that causes a lot of pain. So can we improve the patient's discomfort, right? That's the goal. How can we improve? How can we reduce the pain? And that's the goal of the procedure, both left and right. That's exactly what we're going to do. You know, and these procedures are extremely effective. How can something so simple, right? You know, going back to the spur. How can something so small create so much pain? The nice thing is there's a solution. Get rid of it. That's exactly what we're going to do. So now, looking at the toe from this view, now everyone can really appreciate the explanation. No worries. It's only a video. Like always, www.jawspodiatry.com, Instagram, Dr. Toe Jam, Facebook, Jaws Podiatry, and last but not least, our YouTube channel. Like always, Jaws Healthcare. Have a wonderful day, everyone.